Hello guys, namaste. So we are going to see the AGADATANTRA second syllabus point, which contain the definition of toxicology, definition of a poison, suicidal and homicidal poisons, classification of poison, their action and the route of administration, absorption, distribution, excretion, metabolism and diagnosis, general principles of treatment, duties of a medical practitioner in case of suspected poisons. These are the topics we are going to cover in this video. So, toxicology definition. Toxicology is the science of poisons which deals with the source, toxicity, lethal dose, and the chemical composition, action, treatment, and the antidote, and its medical-legal aspect. What is meant by medical-legal aspect? It is the study and the application of medical and the scientific methods as evidences into the legal cases. Is the medical-legal aspects. The branches of toxicology. The branches of the toxicology are the forensic toxicology, pharmaceutical toxicology, clinical toxicology, and the regulatory toxicology. In forensic toxicology, we involves the quantities and the effect of various drugs on the human body. In pharmaceutical toxicology, we will see the toxic effects caused due to the pharmaceutical products. In clinical toxicology, involves the research, prevention, and the treatment of a disease caused due to the toxins. In regulatory toxicology, involves the collection, processing, evaluation, and the epidemiology, as well as the experimental toxicological data to permit the toxicological basis, toxicological based decisions. So now we are going to see second syllabus point. It is the poison definition. A poison, it is a substance which on inhalation or ingestion, absorption, application, and the injection produces the injury to the body by its chemical action. It is the one definition. And another definition is the all substances are the poisonous. There is none which is not poisonous. The right dosage differentiates the poison from the remedy. Paracelsus is the father of toxicology. Third syllabus point, it is suicidal and the homicidal poisons. The suicidal poisons. The poisons used for the suicidal purposes are the oropharyngeates and opium, barbiturates, potassium cyanide, copper sulfate, etc. A suicidal poison are easily administrable or easily accessible and cheap, might be tasteless and easy to administer into the drinks and the food items. The suicidal poisons are weak into the action and difficult to the diagnose. The poisons which are used for the homicidal purposes are the aconite, arsenic, oleander, and madar, etc. Opium, it is commonly or sometimes used for the killing the children. It's commonly झालं ना? Sorry. Third syllabus point, the suicidal poisons or the homicidal poisons. The poisons which are used for the suicidal purposes are the oropharyngeates, opium, barbiturates, potassium cyanide, and the copper sulfates. A suicidal poison, it should be easily accessible, cheap, might be tasteless, and easy to administer into the drinks and the food items. The suicidal poisons are quick in action and difficult to diagnose. Then the homicidal poisons. The poisons used for the homicidal purposes are the aconite, arsenic, oleander, and madar. The opium, it is sometimes used to kill the children. A homicidal poison should be easily accessible, might be colorless, odorless, tasteless, and is therefore easy to administer into the drinks and the food items. Homicidal poisons are quick into the action and difficult to diagnose. Fourth syllabus point, we are going to see the classification of poison. First classification is the medical legal classification, that is suicidal poison, homicidal poison, cattle poison, drug dependent poisoning, and the accidental poisoning, then abortifacient poisoning, and then stupefying poisoning and the food poisoning. These are the classification of the medical legal classification. Then the second one, it is the systemic classification. The systemic classification of the poison contains the corrosive poisons, irritant poisons, neurotic poisons, cardiac poisons, asphyxia poisons, and the miscellaneous poisons, which will not come in above categories. Then corrosive poisons. Corrosive poisons, example, it is a mineral acids, organic acids, and the vegetable acids. Irritants like the inorganic, organic, and mechanical. Then inorganic irritants, metallic and the non-metallic. In organic, it will be vegetable and the animals, and the mechanical. The neurotic poisons are which affects on the nervous system. These are the cerebral, spinal, and the peripheral. Then the cardiac poisoning, which affects on heart, asphyxia, and miscellaneous. Miscellaneous will contain analgesics, antipyretics, antihistamine, tranquilizers, antidepressants, stimulants, street, and designer drugs. We will see the definitions of under each classification. The corrosive poisons. The corrosive poisons are the highly active ingredient which produces the both inflammation and the ulceration, which will form the both inflammation and the ulceration of the tissue. This group contains the strong acids and the strong alkalis. Example, the boric acid powder burn. You can see in the pic. Then the irritants. Irritant poisons produces the symptoms of and pain into the abdomen and vomiting and the purging. Then the neurotic. The neurotic poisons act on the CNS and the PNS. The symptoms usually contain the headache, drowsiness, giddiness, delirium, stupor, coma, and the convulsions. Then the cardiac poisons. The cardiac poisons are the cardiac poisons act on the heart and may cause the symptoms such as the chest pain, arrhythmia, tachycardia, bradycardia, and fatigueness, dyspnea, and the swelling. Asphyxia. Asphyxial poisons are due to the inert gas or the vapors that displaces the oxygen from the air when the present into the high concentration. This mainly act on the respiratory system and may cause the symptoms such as the dyspnea, headache, dizziness, nausea, vomiting, tachycardia, and stupor. The broad classification of the poisons in the chart form is like corrosive poisons, cardiac poisons, asphyxiants, neurotic, irritants, and the miscellaneous. First, we will see the corrosive poisons. Corrosive poisons are classified into the strong acids and the strong alkalis. Strong acids then again classified into the inorganic and organic. Then organic strong acids like the oxalic acid and the carbolic acid. Inorganic contain the HCl, HNO3, H2SO4. Then strong alkalis are the hydroxide and the carbonate. Hydroxides such as the potassium hydroxide, sodium hydroxide, and aluminum hydroxide. Then the carbonates such as the K2CO3 and Al2CO3 like aluminum carbonate and potassium carbonate. Then we will see the classification of and irritants. Irritants are again classified into the organic, inorganic, and mechanical. Organic will contain the plants and the animal sources like plant source will contain Erenda, Arka, Balataka, Danti, Datura, Gunja, Jayapala, and Karavira. Animal sources such as the snakes, scorpion, spider, and the rat poisons. In metallic poisoning, there will be the in inorganic poisoning, there will be metallic and non-metallic. Metallic such as copper, mercury, arsenic. And in non-metallic poisoning, there will be zinc, bromine, phosphorus, and the chloride. In mechanical poisoning, irritant type of poisoning, there will be the diamond dust and the glass powder. in the factories. Action of and poison. Action of the poison. The poison will act by the local action, by the remote action, by the combined action, and cumulative action. First, we will see the local action. The poison act directly on the tissue or the only act on the site of an application and causes the corrosion, irritation, and the inflammation. The corrosive poison like the bhallataka, as you can see in the pic. Remote action. The poisons get absorbed systematically from the area of application and act on the remote site, like the CNS and heart. In snake bite and scorpion bite, like king cobra, contain the poison which will act on the nervous system. But the bite is on the skin, but still it get absorbed into the bloodstream and act on the nervous system. Then combined action. In vipers and kraits, the poison it is act on the heart. In combined action, the poison affects the both local and the remote areas such as the irritants. Cumulative actions. The poison sometimes not affects the body even if administered several times with the several dosage, then suddenly it produces an effect nearly same to the whole amount of an poison taken at the one time. Example, Hg and arsenic. Then depending upon the duration and the exposure of an poison, the poisons will be the acute, chronic, subacute, and fulminant. Acute will be cause its effect immediate and within a short period. The chronic poisons will cause their action in 3 months, minimum 3 months. Subacute will cause neither acute or not chronic, in between. Then the fulminant, they are the sudden and unstable action or not on the regular basis. The effect of and poisons depends on the following factors. The action depends on the poison itself, like the dosage of and poison, the quantity of and poison, form of and poison, which is the chemical or the physical form of poison, the route of administration of the poison, condition of and poison, and the concentration of poison. The factors attributes to the victim, the condition of and body, like their age, sex, and etc. The condition of and surrounding, like desert, and the presence of and any disease, sleep, exercise, or the intragenic poisoning or idiosyncratics, and the condition at the stomach that will affect. Fifth point, the route of an administration. The route of an administration classified into the local and systemic. Local is also called as the tropical and the dermal, and the second one is the systemic, which is again classified into the eternal and the parental routes. The eternal contain the oral and the anal, and parental contain the intradermal, intravenous, intraosseous, intra-arterial, intramuscular, subcutaneous, and the inhalation. These are the parental routes. Eternal contains oral, sublingual, and rectal. And systemic again classified into the parental, which contain the injections such as the IV, intravenous, intra-arterial, and intramuscular, etc. Then the inhalation and the transdermal. These are the routes of administration, as you can see in the images also. Then sixth point, it is absorption, distribution, metabolism, and the excretion. Absorption. The frequency and the rate of and poison will depend on the site of an application or the route of and administration. Absorption may occur through the elementary canals, skin, lungs, eyes, mammary glands, uterus, as well as the site of an injection. The toxic effect may be local, but the toxic must be dissolved and absorbed to some extent to affect the cell. The solubility is the primary factor. Which factor affecting the absorption. Insoluble salts and ionized compounds are poorly absorbed, whereas lipid-soluble substances are generally readily soluble or readily absorbed and even through the skin. After absorption, there will be the distribution or translocation of the toxins via the blood bloodstream to the reactive sites, including the store depots. The liver receives the portal circulation and is the organ mostly commonly involves into the detoxification and the intoxication. The selective deposits of and foreign chemicals into the various tissues depends on the receptor sites. Is of and chemical distribution depends largely on its water solubility. The polar and the aqueous soluble agents tends to be excreted by the kidney, and the lipid soluble chemicals are more likely to be excreted via the bile and accumulated into the fat depots. The highest concentration of toxins within an animal is not necessarily found into the organ or the tissue on which extract and the maximal effect the target organ. Lead may be found into the highest concentration into the bones, and which is neither a site of a toxic effect nor the reliable tissue for the toxicological interpretation. Knowledge of translocation characteristics of toxicants is necessary for the proper selection of the organs and the analysis. Metabolism. Metabolism of a biotransformation of toxicants by the body is the attempt to the detoxify. There are two phases of metabolism. First phase 1 includes the oxidation, reduction and the hydrolysis mechanism. These reactions, catalyzed by the hepatic enzymes, generally convert the foreign compounds to the derivatives for the phase 2 reaction. Phase 2 principally involves the conjugation or the systemic reactions. Usually, the fraction is excreted unchanged and the rest of excreted stored as the metabolites. The increased tolerance to the subsequent exposure to the toxicants in same instance, it is due to the enzyme induction and initiated by the previous exposure. Then excretion. Excretion of most of toxicants and their metabolites is by the way of the kidney, and some excretions occurs into the digestive tract via the milk, saliva and sweat and the urine, etc. The toxicants are removed by the kidney by the glomerular filtration, tubular excretion by the passive diffusion and the active tubular secretion. The damage to the kidney from the excretion or the xenobiotic is the specific to the anatomical location where the excretion occurs. The excretion site are proximal convoluted tubules or the glomerular or the medulla, papilla or the loop of Henle. The proximal convoluted tubule, it is the most common site of endotoxic induced injury. The elimination and disappearance by the metabolic changes of a chemical form, an organ or and the body, it is expressed into the terms of a half-life. They defined as the amount of time required for the disappearance of half of the compound is called as the half-life. The rate of elimination usually depends upon the concentration of the compound, and the different body compartments will likely have the different elimination rates.